the difference between an OB triage staffed with nurses versus an OB emergency department is that we have a dedicated staff that is nurses and a physician that are there to evaluate every single patient and examine them, whether they have an antepartum problem and need to be admitted for closer evaluation and monitoring of their pregnancy, or whether they're in labor, especially in a private MD is in the clinic or at home. You're able to then set your eyes on the patient, determine if they're in labor, determine the fetal status, and then when they are moved over to the other side where if they are in labor, you are there on site 24/7 so that the nurses also have that extra resource, especially if they have a fetal monitoring strep that might not look the best and are uncertain as to whether this needs to have an immediate action or if they're able to continue laboring. They are in the middle of the night and you have a physician who can't necessarily come up immediately and evaluate their patient. They're able to use us as that stopgap and provide better care for the patient. Also, we are able to reassure the patients because they know that there is a physician 24/7 in-house and are able to provide that immediate action, especially when things turn on a dime in the labor and if there becomes a dire situation where the patient needs to go for an immediate delivery. And all those precious minutes count for a baby and a mom if she's bleeding or if a baby's heart rate is down, so that we can have better outcomes for moms and babies.